All right, we know that we have on your voting list before you, you have a number of withdrawn bills. And we have received some additional bills that the sponsors have requested be withdrawn. So if there is no opposition, I would like to read, just for the record, the numbers of the bills that have been withdrawn, and then I'll entertain a motion. So we have Senate Bill 128, which you have before you, Senate Bill 378, Senate Bill 415, Senate Bill 500. In addition, there are 4 Harford County alcoholic beverage bills that are Senate Bill 736, Senate Bill 737, 739, and 740. Those are 4 local bills that they have requested be withdrawn. And then 1 additional bill, Senate Bill 401, which is an electronic benefits transfer cards bill. That is also, we have a sponsor withdrawal letter on that one. Any questions about those bills that are withdrawn by the sponsors?
Excellent withdrawal.
Have a motion and a second. I take it that was a second, Senator Reedy, on the unfavorable?
Enthusiastic second.
All right. Any questions? All those in favor of the unfavorable, raise your hand. That's unanimous. Thank you. All right, if there is no discomfort, we'll start working on bills. Nathan will go first. Thanks.
First bill is Senate Bill 232, for which you have a reprint. This bill authorizes a licensed athletic trainer to perform dry needling as a specialized task if the athletic trainer is approved by the Board of Physicians. The board must issue an approval to perform dry needling to a licensed trainer who completes at least 80 hours of instruction, including at least 40 hours of hands-on instruction as specified. There are some amendments. The first adds a sponsor. The next, which you can find on page 3 of the bill, is offered by the bill sponsor, Senator Beidel, and it clarifies requirements related to the hands-on instruction portion of the education requirement. The board has confirmed that these amendments address their concerns raised in the board's letter of information. And there's an additional amendment offered by the chair that strikes an erroneous cross-reference.
We got a motion.
Favorable.
Second.
Have a motion and a second for a favorable on Senate Bill 232. Are there any questions or discussion? All those in favor, raise your hand. That bill receives a unanimous report. Nathan?
The next bill is Senate Bill 396, which alters the voting membership of the Upper Shore Regional Council by removing the 3 Cecil County commissioner positions and replacing them with the county executive of Cecil County and 2 members of the Cecil County Council. There are no amendments, no fiscal impact, and there was no opposition at the hearing.
Senator Mounts?
Second.
Have a motion and a second for a favorable on Senate Bill 396. Any questions or discussion? All those in favor, raise your hand. And that's a unanimous report. We'll go to David.
The first bill on your list is Senate Bill 26. This bill, as amended, and you have the reprint in front of you, requires the health department by January 1st, 2025, and subject to the limitations of the state budget and federal law. So in other words, if there's no money or the state determines there's no money, they don't have to do this, to establish an express lane eligibility program to enroll individuals in Medicaid and the Maryland Children's Health Insurance Program, MCHIP, based on an eligibility finding by the SNAP program, which is run by DHS, Department of Human Services. To put this in a little easier way to understand, basically, there's no changes to any Medicaid eligibility limits. What this does is for redeterminations, not for an initial application for medical assistance, that if you're already eligible for SNAP, you would be automatically eligible to continue benefits if you're already on the Medicaid program. The reprint in front of you is a reflection of the work the House already did on this bill. And they actually started work on this early, and there's also an amendment offered by the sponsor on the bill. So the amendments on this bill are the same, except for the sponsor amendment in the back, which I'll go over in a minute, that the House has adopted on their bill and the full committee will be voting on very shortly. So if we go through, you'll see that most of the language regarding the eligibility for Medicaid is maintained, but there was language suggested by the department. And this was also offered by the sponsor and included on the bottom of page 2 of the reprint. You'll see that at first they have to start on redeterminations only, and then they can go to initial determinations for medical assistance. It also requires that they go for waivers. Under current law and federal law, this is the case already for CHIP. What this bill will do is adopt a model in Massachusetts where you can expand this eligibility to members of the child who is in CHIP. So all people in that household would be experience this expedited redetermination for services. So if they're on Medicaid now, all they have to do is make sure they're eligible for SNAP and they would continue on Medicaid. They still have to come in for initial determination. The reason for the waivers is there's an attempt to maybe go beyond this and extend this to childless households with no children, but they would have to get a waiver for that. And that's why this language is in here. And again, it's subject to the approval of federal government and the state budget. There was language in here also that said if you were eligible for SNAP, you would also be automatically eligible for SSI and also for the LIHEAP program, or not LIHEAP, but EUSP. The House took them out for 2 reasons. One, DHS wanted the SSI language out because they weren't there yet. And also the EUSP is under the jurisdiction of the Economic Matters. This bill is in HGO, and Economic Matters suggested they take that piece out because they like to control over RGGI and where that money goes. And this committee now no longer has control over RGGI, has authority over RGGI. That's done in EEE. So HGO took those items out of the bill. So now you're just left with determinations for renewals for children on CHIP and members of their households. And if they're eligible for SNAP, they're automatically redetermined to be eligible for Medicaid. And on the back of the bill, there's language that was added by the sponsor. There's apparently a study that was initiated several years ago. And you'll see in a reprint that they didn't quite finish their work. And so the sponsor is suggesting you continue that work group until they finish their work until 2024.
Is there a second? Have a motion on the favorable. Have a motion and a second. Discussion. Senator Reedy.
Okay, excuse me if I make you repeat yourself, but I'm just trying to be sure I understand where we are here. Because I had some concerns. I have a couple concerns about the bill. It's obviously been altered quite a bit. Walk me through again. If you are SNAP eligible, this bill makes you automatically Medicaid eligible because you're SNAP eligible?
If you have to be already eligible for medical assistance first before this bill would take effect. But what this does is you're already on medical assistance. You're a child who's either in the CHIP program or members of your family are on medical assistance. Instead of coming in and going through this whole process for redetermination for eligibility, if you're eligible for SNAP, you're going to be automatically eligible to continue in the Medicaid program since you already are on Medicaid.
Because you
So
wouldn't be getting SNAP if you're not already on Medicaid.
not necessarily, because SNAP eligibility is much higher. So it's 200, SNAP can take you up to 200% of poverty. Whereas medicals for a child on CHIP, it's 180% of poverty. And for families, it's like 130% of poverty for regular Medicaid.
Right.
But none of that changes. All this means that if you're eligible for SNAP and you're coming in for a redetermination, the data is going to be linked. They haven't done that yet, but they're going to start that process. All they have to do is check and see that you've already been determined eligible for SNAP. Then you're going to be automatically eligible to continue under the Medicaid program.
If you were eligible for Medicare.
If you were eligible, yeah. It doesn't mean you, eventually, I think there's gonna.
It's going to help keep you on Medicaid because you're on Medicaid, and if you're still eligible for SNAP, you're into. If you're coming in, I'd say, hey, am I still eligible for SNAP? And they're like, hey, yes, you are. Oh, and by the way, yes, you're still
Yeah.
eligible for Medicaid.
And
That's
it
the
cuts
idea.
a step out. If you ever, this I can speak from personal experience. If you ever sat through a redetermination process, you have to go in, meet with a caseworker, and they have to take all this information and say, yes, you're still eligible to continue on. This would eliminate that step and just say that, okay, you've already been determined to be eligible for SNAP. You can continue on in a Medicaid program without any other further steps.
But it doesn't change Medicaid eligibility. It just
Doesn't
says.
change any
I
eligibility.
know I've asked it like 3 times different ways.
Yeah,
I'm just trying-
it doesn't
making
change
sure.
any
Yeah.
Medicaid eligibility.
And then beyond that and beyond this work group continuing, does it do anything else?
It requires that they go get a waiver to try to bring in other single family households without children. Basically, the idea is to hopefully get adults without children who are eligible for Medicaid into this. But right now, you have to have a child in a household for this to take place. But you need a waiver to go beyond that. So the federal government would have to approve that.
How would somebody can get SNAP that doesn't have children, right? So
Yeah.
So this would,
Yeah.
right now, it's only if you have, the only thing this bill's doing is you have children
Yes.
and they're in the program.
Yeah, and you'll need a way, as I understand this, you'll need a waiver to extend this type of expedited eligibility to single or to households without children.
Right, but we have to get that waiver. and we
You have to
haven't
get
gotten
that waiver.
Okay.
yes.
And they still would have to be eligible.
They
even if
still
we
would
got
have
the
to
waiver.
be initially.
They'd have to already
eligible.
be eligible for
Yeah,
one.
you-
to
they
check
just
the other.
you just can't send somebody a letter and say, hey, guess what? You're eligible for, you have to come in and you have to sign up for the
Okay.
benefit and you have to go.
Because
through.
before there was a couple of other things in here and we've taken those out because you explained why. So that's,
Yeah.
okay. All right, thank you.
Thank you. Senator Hayes.
Thank you, Madam Chair. And David, this bill goes into effect of October of this year.
Yes,
And I noticed in the fiscal note, it wasn't referred to do it or anybody. So MD Think is the eligibility system that they're using right now. Has anyone indicated on whether or not they could actually match this data?
they have to, I don't think they're working on that now so they can match the data. That's one of the things they have to do, and hopefully they'll have in place by October 1st, 2023. They'll have plenty of time to get this done. The federal law, if I read the fiscal note and the information from the health department correctly, already requires that the state start this process for children. So under federal law, you have to start doing this SNAP eligibility for children in the Children's Health Program. So they're working on it now. They just have to expand it a little bit. What Massachusetts has done apparently is expanded this to families with children who are on CHIP. And if the families are eligible for Medicaid, then this would also apply to them. So they should be working on it now to comply with federal law regarding children.
Mhm.
So the idea, I guess, is to hope to have this thing complete by October 1st, 2023.
Yeah, I'm just not optimistic that that's going to happen. I think the policy is right and definitely for families that serve them well. But given the challenges with the current system, it'll be a good thing to keep an eye on. But it's a good policy, especially to benefit families who are most vulnerable here in our state.
Noted. So I have a motion and a second for favorable. Any further discussion, questions? Okay, all those in favor, raise your hand. Okay, that bill receives a unanimous report. David?
Okay. The next bill is Senate Bill 170. This was held last week. This deals with certain types of energy projects. Covered projects include 2 megawatts, which are solar projects. It would require these projects, if they have the certificate from the Public Service Commission to operate, that the developer of this project has to make sure that the contractors and subcontractors either pay prevailing wages on this project to their employees, or they would have to have a public, why am I drawing a blank on this? Project labor agreement, not public, project labor agreement in place with various factors. So if the developer has a PLA with with the contractors, subcontractors and their employees, they would not have to pay prevailing wages because somewhere in that PLA would be the determination of what wages would have to be paid. The developer under this bill would also have to make sure that the contractors and subcontractors are capable of meeting the project requirements and use appropriate apprentices, make sure that not to misclassify their employees. The entity responsible for administering compliance with the bill would be the Maryland Department of Labor. And there is an amendment offered by the sponsor on the back page of the reprint, which makes this bill prospective. It specifies it as prospective and doesn't affect any PLA or any contracts or any projects undergoing right now.
Senator Beidle.
I guess we need a motion a second first, right? Because I have a question.
No, you can.
Okay, I have a question. So where does it say anything about a project labor agreement?
If you go to the reprint on page 2,
Mhm.
you'll see that on lines 15, this section applies to a construction of a covered project. C, the developer of a covered project shall ensure that workers are paid not less than the prevailing wage determined by the Commissioner of Labor and Industry under state finance and procurement, unless that covered project is subject to a project labor agreement.
Okay,
And then
unless-
if you follow, you'll see through the bottom of the page and on to the next page, what that PLA must include for them to get out of having to pay prevailing wages.
Okay, thank you.
Vice Chair, okay, have a motion for the favorable. Is there a second? And a second. Senator Reedy.
So this bill now says for these size projects, you can't be an open shop. You have to have a project labor agreement. Or is this,
You either have to have a project labor agreement or you have to pay prevailing wages.
and I was trying to check the fiscal note real quick, but my concern is just adding more cost to energy generation. And we're getting smaller and smaller with when we're requiring these prevailing wage requirements. That's more of a statement than a question, I guess, but I'm concerned about, it says it's not going to increase our general fund revenues. It's really going to drive up costs for generation projects that small businesses are engaged in, but I think that's a problem, but that's a statement, not a question. Thank you.
No, I follow your question, and I think I recall from the hearing, this was one of those bills that put us into compliance or eligibility for some federal, right? Was this?
The testimony during the hearing was that if there's a tax credit available, a federal tax credit,
Right.
if you want to take advantage of that tax credit and you're one of these generation projects, you would have to comply with Davis-Bacon, which is the federal prevailing wage law. This would say that you would, instead of if you take, regardless of whether you take the tax credit or not, you would have to either pay prevailing wages on this project or have a PLA in place. So whether you take the tax credit or not, under these 2 megawatt, under these types of covered projects, you would have to pay prevailing wages. I guess the assumption by those who testified on the bill that these folks would take advantage of the tax credit and be subject at least to Davis-Bacon. But the state prevailing wage law actually is a higher wage than the Davis-Bacon wage.
Any further questions or discussion? Okay, I think I had a motion and a second for the favorable. Is there a question? Okay, all those in favor of Senate Bill 170 as amended, raise your hand. Any opposition?
It's a party.
Noted. All right,
Okay, and the last bill does not have any amendments. This is Senate Bill 258. This was heard last week, and it alters the minimum standards for physician credentialing process that a hospital must have in place as a condition of licensure by the state. The formal written reappointment process for physicians must be conducted in accordance with standards of the accreditation body, which is JACO, that accredits hospitals rather than every 2 years. So under current law, every 2 years, the physicians, the hospitals would have to come up with a process to accredit their physicians. This puts it in the hands of the national accrediting body, which I believe now is currently every 3 years that these physicians would have to be reaccredited. So it just, instead of specifying a number in the law, it goes with the National Accreditation Organization. This isn't new. Several years ago, there was a legislation that was passed that allowed licensure to be based on a lot of national accreditation bodies to ease the process of continuing with a license in Maryland. You could almost argue this goes along with that process.
I moved. I'd like to move Senator Lamb's deregulation bill.
Have a motion. Is there a second? Okay, a motion and a second on the favorable. All those in favor, raise your hand. Any opposite? Nope, that's unanimous. All right. That was the last bill. I'll be seeing some of you about presenting some of these bills on the floor. You will be visited. Anything else? Okay, we're adjourned. Thank you. Great work.